I think well, high CT is definitely an improvement compared to the previous generation.
ICT has been a major step forward. If you now look at how the future will go, we'll see functional imaging become much more important.
In a clinical experience working with the ICT, our experience is that the image quality never ever is non-diagnostic.
If you look at the development of CT from the early 90s to now, you can see that CT has moved from step-by-step single-slice acquisition to spiral CT to multi-slice spiral acquisition, which ultimately allowed you to get isotropic imaging. That will help us evaluate cardiac function and cardiac perfusion, which is something we can't do at the moment. It will also help us evaluate lung function, lung ventilation. I think that there CT will have a role.
Especially the ICT now offers a rotational speed which is absolutely industry leading at the moment with 270 milliseconds rotational speed. And that means this rotational speed provides us with very precise images and a very stable image quality.
Evolution of the scanners has brought us much more detailed description of anatomy and pathology. And as we now go to cardiac imaging, we are able to get consistent high image quality, are able to do non-invasive assessment of the coronary anatomy and, of course, pathology as well. And we can also look at a lot of the other morphological features in the heart, but, of course, everywhere else in the body as well. I think that the main advantage of the new generation of CT is, apart from the more stable and really very good image quality, the fact that we're now able to do that with a substantially reduced radiation dose.
When a patient presents on the ER with symptoms of an acute stroke, time matters. You want to treat that patient as fast as possible, and it is very important to have the door to needle time in between the patient's admission time and being able to treat the patient with thrombolysis, to keep that well within an hour, and every minute matters.
If you look at the impact of ICT on patient care, then I must say that it helped us especially for cardiac imaging. And there, the dose reduction, I think, is the most important issue that you have to consider. We're now doing cardiac scanning much more rapidly with much less dose and much less contrast than we did before.
Advantages of a CT are that we get really a 3D data set, not only a 2D projection. We can visualize changes of the wall of the vessel, coronary calcifications and non-calcified plaques.
The new ICT technology has definitely changed the way we work with the patients with acute CVAs. About 10 years ago, we started out with the single-slice CT scan. That CT scan took too long to be able to manage our patients. We've had now the 16-slice, we've had the 40-slice, the 64-slice, and now the ICT.
We'll have to become more specific in the characterization of the diseases. It has become reliable in terms of reduction of dose, in terms of image quality, and in terms of speed of acquisition. But now we need to move to another step, yes, to get better characterization of the disease.
CT perfusion is one of the areas where ICT has already made a step towards the future. We see very good image quality when 3D reconstruction is used. We can cover a reasonable amount of brain, and we are able to solve many of the immediate clinical needs for patients with stroke, but we expect to be able to expand it to other indications in the brain and in other parts of the bodies as well.
Even at this time with the global recession, it is important that we keep carrying on with our technology. Stroke is still one of the main causes of death in the world. It's the third cause of death following cancer and heart disease, and it's the first cause of disability. So we need to be able to treat those patients.
CT will even further enhance its role in clinical practice and will move much more into functional imaging in oncology, in cardiology, in pulmonology, and of course in neurovascular imaging.